Choosing an in-home care provider doesn't need to be a difficult process. We created our care program to ensure your loved one receives consistent, professional care every step of the way. Here's Already HomeCare founder Derek Bullard.
When you call us, you're going to reach a person who will schedule a time for an in-home assessment. We'll do those assessments same day quite often, or we'll do them within 24 hours, whatever is most convenient for you and your loved one. We're going to send an RN or an LPN out in your home. You're going to always have a licensed person that's going to do that assessment. In that assessment, we're going to identify what are some of the care needs, what are your cultural preferences, if you have any. Are there any safety issues in the home that we need to be aware of in terms of fall risk, handicap rails, guard rails that we need to maybe look to install. So we're going to help you with that to ensure that your loved one is as safe as possible in receiving the wraparound care that they need to keep them in their home, which is where most folks want to live when they need help with independent living skills. The other thing that's going to happen after we provide that is we're going to give you access to a phone number where you can reach a person 24 hours a day, 7 days a week. If you have a question about the care they're receiving, scheduling related issues, or a complaint or an unresolved issue. So you'll always reach a live person. That's one of the key facets that I think is important about our service. Another big benefit of our service is we contract with a company called ADLware. ADLware is the electronic medical record that we use to document services. Our caregivers will document their hours in that program, but also there's a family portal. That family portal would give you access 24 hours a day, 7 days a week to view the care that your loved one's receiving. You can look at the service note, you can look at the services that were provided. You'll even see a picture of the caregiver that was in the home. So if you're 600 miles away and you don't know the person, you'll have a good idea of who it is. If you call us at the last minute and for whatever reason request another worker, or you need another worker, you'll be able to log on before they get there and know what they look like. You'll see their background. You'll have a little bit of information about their likes, their dislikes, their training, and their family. My goal is for Already HomeCare to be the premier and the best home care provider in Charleston, South Carolina. In fact, we'll settle for nothing less.